Hi, I'm Angry Bill for Prehospital Wisdom. I want to talk to you real quick about how you can practice for high acuity, low occurrence events. High acuity, low occurrence, meaning halo events, are events that don't happen very often, but when they do, something serious is going on. In the pre-hospital setting, think of Crike. Crike is what we're talking about. That's like one of the ultimate halo events in the pre-hospital setting. So how do you practice this regularly in a way that's cheap and effective and works and works out? So a study was recently published in the Annals of Emergency Medicine by Johnny Schneider et al. Called Mental Practice, Applying Successful Strategies in Sports to the Practice of Emergency Medicine. So back in high school, when I wrestled or played baseball, I could remember going through visualization practice to lower my anxiety, lower the butterflies before a wrestling match, but also to picture the kind of success that I wanted on a baseball field, those kinds of things. Visualization, positive visualization of difficult skills has been in practice in sports for a long time. So this study looks at whether or not you can take a lot of those practices and put it into an emergency medicine or pre-hospital medicine setting for us. What they say is a mental practice is a form of cognitive walkthrough that has been shown to be an effective method for improving motor and cognitive skills, with literature in sports science and emerging evidence supporting its use in medicine. So what the author's saying is that high fidelity practice and high frequency practice are both sort of difficult to attain, especially when we're talking about stuff like crikes and intubations, and there's only so much you can intubate a rubber head. You have to take that extra step with appropriate mental imagery to make that as productive as possible. Most of the studies, especially those in the footnotes of this study, come from the world of surgery. Surgeons visualizing how they're going to access a certain part or perform a certain procedure in surgery, and that makes a lot of sense. Can we take that same process and put it towards pre-hospital setting? So obviously, I think yes. This concept of cognitive rehearsal without physical movement seems to be a good one. Closing your eyes and picturing yourself walking through the steps of a difficult skill. And whatever that difficult skill is for you, walk through the steps of finger thoracostomy or walk through the steps of crike, or specifically doing it correctly inside your head. That's one of the most important parts, is how you're going to hold pressure of the crike, or how you're going to stretch the skin, where your first incision will go, and then picturing success. If you're at a lower level, picturing success in an IV, just inserting the catheter, boom, flash, advance it, done. That's a great way to visualize it too, especially if you're having difficulty, especially if you're in a batting slump. This is going to be most effective if you imagine as much detail, as much specifics as possible. What's it going to feel like? What's it going to sound like? What's the lighting going to be like? Picture it as close to realistically as possible. Let the movie run in your mind, but go specifically from step to step, how you're going to use the bougie and the crike, or where you're going to put the tip of the laryngoscope blade. Those kinds of things really specifically, and imagining that even with a little bit of hand motion as you're working through it to think through this. A lot of this comes from the concept that your brain doesn't know if it imagined it or if it lived it. Memories are memories. So the more that you can imagine this, the more that you can walk through this process, it's almost like specifically doing it. And without the cost of high fidelity simulation that's difficult to find place to practice and time, and even the most high fidelity stuff isn't as perfectly high fidelity as what we're looking for. Listen, it's really nice to stab a needle through some pork ribs, but imagine adding, in addition to that, the ability to quietly think through this process, think how you're going to do it, think how you're going to overcome problems. That positive visualization sounds really hippie, and between this and the energy post that I just went with, there should be a card up here somewhere. The woo in Angry Bill is coming out a little bit too much. I promise I'm not that big a hippie. One way or the other, maybe this is something that'll help you and help you with your practice. Once again, I'm Angry Bill. This is Pre-Hospital Wisdom. You know all the YouTube stuff. Like, comment, subscribe, share. Especially the subscribe and share. It helps us out a whole lot. One way or the other, until next time, stay safe.